So at Hartsfield-Jackson, we have a very integrated, collaborative plan with our CDC partners, our Customs and Border Protection partners, and of course our airline partners and all of the contractors who work at Hartsfield-Jackson. We are still doing the same protocols with the Customs and Border Protection for Chinese and Iranian travelers will come in, will get mandatory screening. And these are U.S. citizens that are coming back from visiting those countries. That's still happening as we go on. They will then be questioned in initial screening by Customs and then followed by a screening and secondary screening by CDC with contractors from local hospitals. And pending those results, they will go to tertiary screening, which is done in the CDC quarantine room. And pending that, if necessary, they are taken to Emory. And so far to date, we have only had one passenger that has been taken to Emory, and that person was released after 72 hours for not having the virus. Our cleaning protocols and our emergency response plans and our pandemic plans are fully integrated. Our emergency operations center at the airport is operational. Our EMS staff from Atlanta Fire Rescue are all trained with the correct PPE and ready to roll if necessary. And our cleaning protocols throughout the airport, the escalator rails, the bathrooms, have all been increased, and we are using the EPA-approved peroxide cleaning solutions. Our airline partners for all international flights are cleaning their planes from top to bottom on the arrival of every flight. We're cleaning the jet bridges, and as of today, we are procuring numerous hand sanitizers that will be delivered rapidly throughout the airport for our customers and passengers that are of any concerns. Thank you, Governor.
All right, thank you, John. All right, we're going to open it up for questions. Obviously, Dr. Toomey's here. She can talk about, the up-to-date information on the testing at the lab. And then I think most of you all know the folks that are serving on the task force. If there's any other questions that we can try to answer for you, we'll do that. Richard.
You said that Medicaid, Medicare, and commercial insurance will cover. What about the part of the population that may not be covered by these things? Is there a place they can go? Can we help them?
Okay.
Yeah, no, and I'm glad you asked that, because if you are uninsured, we will provide the test for free, so for no charge. And I wanted to make sure that message got out, that although it's covered by insurance, we will not charge for that test.
Dr. Toomey, one question we're curious about, now that the state lab can test for coronavirus, can they do this independent of the CDC, or do they still have to go to the CDC for final confirmation of
Right.
coronavirus?
No, that's another excellent question, because it's a work in progress. Right now, we still go back to CDC for confirmation. We may be at some point in the future not have to do that, but at this point in time, we still are doing that until we're kind of fully certified.
Now, are they using the CDC issued kits, or are they using those FDA issued commercial?
Well, they're both one and the same. They're CDC through FDA issued, FDA approved. And we have 150, we were given 150 test kits, and we have gone through already 50. I mean, today alone, we had double-digit individuals tested. And so already, because the strict criteria that had been in place by CDC has been lifted, we have more leeway in order to approve testing. But testing still needs to come through us. The epidemiology unit still has to approve the testing before it can be sent in to us. Private doctors, hospitals can take the test, secure the test. Remember, these are nasal swabs. These are not blood tests. Nasal swabs. It has to be performed carefully with protective equipment and mask and eye covering. It can't be just done in an open room. So not everybody is able to take the test, secure the test.
All right, folks, Greg, I'm going to try to jump in and try to make sure everyone can hear the question. So if you can just raise your hand, I'll try to call as many people as we can. Greg?
Governor, while lawmakers are still in session, are you considering asking them for more resources for a package for legislation of any kind to deal with this crisis?
Well, I haven't done that yet. I know they stand ready. I mean, we have two legislators that are on the task force, and we certainly appreciate Senator Watson and Representative Cooper being willing to spend their time during this busy time of the year to be with us. But I believe from, especially the thing that concerns, I think, Dr. Toomey and I most is the funding aspect of this. I think the Congress has addressed that. I know that I've spoken multiple times to the Vice President about that. He realizes as a former governor that we are on the front lines of this. We're going to have expenses, and the federal government is going to be working with us on that. They have asked us for what we think those expenses will be, some that we have already occurred, so that they can make sure it was in this emergency spending bill. But look, we stand ready. If there's something else we need to do, we will. But from a legal perspective, working with the Attorney General's office and our attorneys, the governor's office has broad emergency powers that open up a lot of things that we can do to help with situations, whether the legislature's in session or not. We're not considering anything like that right now. But, that I think can give comfort to our citizens. And it's been like that for a very long way, and I think governors have used that wisely in the past.
Dr. Toomey, can you talk to us a little bit about we understand that there was certain incidences with Asian Americans that are perhaps being stopped and a little bit of fear in the community against Asian Americans. What is your message to them in terms of if they're being stopped or that kind of backlash for that community here in Georgia?
I'll say a few words, and the governor may want to say a few words as well. I think we are very concerned about the stigma and discrimination that has emerged throughout these events, these COVID-19 events. And I think the message to the public is anyone can acquire coronavirus. It's not unique to the Asian population. It's not unique to one race or ethnicity, and we need to be very cautious that we ensure the safety of all communities in Georgia and throughout the nation. And so we are very concerned. If you look at our website, and I'd say our website has the most up-to-date information available on what's going on in Georgia now. You can see that we actually address that with specific public messaging about that, because we are very, very concerned. We also have developed a PowerPoint presentation which will be posted, if not today, tomorrow, which is available to be used by faith leaders, community organizations, others, to try to, again, address this issue and provide general information to try to quell some of these concerns and some of the misconceptions about what coronavirus, COVID-19 is and how it's transmitted.
And I would just add, that's one reason I specifically wanted John to talk about the protocols at the airport. I think that should give people a lot of peace of mind about people that are coming in and out of the country at this point from really all areas that have been affected, obviously Italy, South Korea, and China, and certainly Iran, which have the travel restrictions.
Andy?
Dr. Toomey, do you know how many people have been tested so far prior to today here in Georgia?
We had just a small number tested prior to today, and virtually tripled the number just today with as we expanded the testing criteria.
With more testing, do you expect to get more positive cases?
We expect we will ultimately find more tests, more positive cases, more positive tests, because the more you test, the more you find. And as we know, 80% of COVID-19 cases are very mildly symptomatic, if at all. So we expect so, although we do not feel at this time we have any indication that the virus is circulating in the community, that there's wide community spread. We still feel the risk is low throughout the state.
And are you concerned about possible shortages of personal protective equipment in healthcare facilities?
That's something we're working on actively, and we're working on with our emergency preparedness and GEMA colleagues, and not only to ensure that that hospitals have adequate equipment, that we within public health, because we may be involved in securing these tests, we'll also need the PPE, and so that's part of our preparations that we're undertaking right now.
All right.